All right. I have a 7-year-old girl in kindergarten with SM. We began exposures, fade ins when she was in preschool last year. We also tried playdates exposures outside of preschool. In kindergarten, she has been doing weekly lunch bunches for about 15 to 20 minutes with one or two of her peers with the school counselor. Despite these exposures, we haven't seen much improvement. Do you have any recommendations on how we can get her past this stage? We're thinking about medication, but my husband thinks that the SM would just come back once we take her off the meds.
Wow, this is a lot going on in this question, Brad. A lot of stuff is going on. Here are the things I'm thinking about. I'm hearing the word exposures, exposures, exposures. Exposures are fabulous. What are you doing during those exposures? Are you using specific interventions that were developed for your child? Or are you just putting her in these environments? Are the teachers asking questions in the right way? Are they pairing and grouping her with the same buddies that you're working on play dates with, that you're doing small groups with? And even when you're doing play dates, are you transitioning those play dates into the school? Are you playing games and activities using strategies to bridge that child into verbal communication? To me, you're doing the lunch bunch, you're doing a small group out of the room, you're using one or two peers. I would just say, are those lunch bunches with those one or two peers with the same buddies you're pairing and grouping that child with? So that's the setup. Everything I just said is what I call the setup. It's setting up the environment, but it's the strategies, it's the interventions within those settings, in the lunch bunches with those one or two peers, making sure they're the buddy process, the same peers you're pairing and grouping with, working on outside play dates, transitioning into the playground, the empty class, into the room, and doing those strategies. So I'm not hearing anything about strategies. I'm just hearing exposures. So it's a very two-prong approach to be able to treat a child, and you never hear the word accommodations without interventions. So all I'm hearing is accommodations. We're doing it, we're setting her up. And so again, I don't even know what the fade-ins that you were talking about originally, because fade-ins are great and I'm an advocate of it and we use it, but what are you doing during those fade-ins? So I think the key here is talking to your treatment professional about what strategies to use in those environments. I'll give you an example. If your child has progressed into speech through the strategies the strategies you're using at home during play dates, whatever those strategies may be. For some children, it's simply running around outside. They get comfortable, they get verbal. Sometimes it's through facilitated play dates where parents are doing an activity with a child that the child loves and feels confident in, and they're bringing them into social communication by the way they question. Do you want red or blue? No answer. Red or blue? Tell me. And they start verbalizing or sounds to words in a very strategic way. It's not just sounds to words, it's how you use sounds to words for that child, for your child. So I'm not hearing that, right? So I think the first step here is really figuring those strategies out. And that's what your expert in SM needs to be doing with you. As far as medication goes, I'm not telling you whether to use it or not. I'm an advocate of medication when needed. And what does that mean? It means that you're using the strategies and interventions, you're providing the accommodations within the school, you're setting up the world for this child out in the community, exposures, etc., playing the games, doing the goals, and you're doing it all, and the child is really anxious, really stuck, or they have other reasons that are enhancing their anxiety: social anxiety, generalized anxiety, separation anxiety. Perhaps they're a very sensory sensitive child and they get incredibly overwhelmed and shut down in community settings. I mean, you can hear, I can go on and on all day about this question. But if medication were a choice, before I would use medication in this particular child, brand, what I would do is really talk to your SM professional and get those strategies. It's not just exposures. What are you doing? And really work those strategies. In my experience, when the parents are taught strategies of how to use them and the child is practicing those strategies within a treatment session and the school is providing the proper interventions and they're using those strategies in the small groups in and out of the room, they're pairing and grouping, asking questions the right way. Usually, obviously, using visuals is critical for every child because that helps minimize the need to think and process, and then they hear the answer with choices. There's lots of beginning ways to use that. Some kids use sounds to words and it works like a charm, or a ritual sound approach because this child is 7 years old. So again, I don't want to confuse our listeners, but I think what you're hearing from me is every single child is a recipe. of strategies and interventions, and you set the world up that's specific for that child. Of course, many strategies and interventions are similar for different children. It's how you put it together. And I'm not hearing that at all in this question. So before I would use medication, I would really be sure you're using all those strategies in the right way. And if you use medication and you titrate it up incredibly slow, where you're monitoring side effects as well as progress, and the child gets to a point where they're seeing and hearing themselves successful, usually 9 to 12 months, we usually like a period of time, and then you slowly wean off. I mean, I don't have any cases where the child just goes back to SM, but I can because all along the way, even with the weaning, you're making sure that you know how to use those strategies if the child does start to bridge down, for example, which they typically don't, because the child has seen themselves a certain way, hear themselves a certain way, have built the comfort, have connected with peers, feel, have progressed one-on-one, let's say with a teacher in speech, whatever they may be. But the child becomes a more functioning individual socially, emotionally, academically, and of course, communicatively. So therefore, weaning is really a slow process. But again, I don't have a child that reverts back to selective mutism, but I can see that happening if you have a child that is just being exposed, using exposures and setting up the house, so to speak, setting up the world, but you're not using the interventions, because you're absolutely correct. That child has not built the coping skills yet, Bran, and the child is just using exposures. Maybe that child will progress into speech, but if you as a parent don't know the interventions to use to help that child make, bridge up or bridge down, then what's going to happen if that child goes silent when you take the meds off? You don't have the strategies to bring them back. And again, because these strategies, and I'm teaching these parents all along the way of how to bring that child into communication, when to do it, how to do it, what do you use, what questions do you ask, pairing, grouping, etc., teaching teachers how to question, when to question, with who to question, etc., and what strategies. The kids don't go back to SM because they know it. It's in their toolbox. So even if the child bridged down, the teachers are accepting where they're at, and maybe they know why that child bridged down. Maybe for a sensory child, it's a loud, large, lots of people environment, and they're shut down. Maybe they have insecurities with learning. Maybe there's and they see their peers rushing through the work, and the child gets very anxious because they can't do it. Is it their insecurity? Is it a learning challenge? Maybe they have a speech and language issue. So you're asking open-ended, thought-provoking questions, but meanwhile, they have an expressive language disorder. I mean, you can see that with different whys, you need to understand that. That's why I'm so big with the whys, and I repeat this all the time. You need to understand why a child developed SM and why it is continuing. You don't have to focus on it. Once you know it, you focus on those whys, but you're not like constantly saying, okay, my child has a learning challenge, This is why they're not speaking. You accommodate that learning challenge. You accommodate that speech and language, and you use, paraprofessionals. You use a multidisciplinary approach to support that child in areas. Now, maybe it's just a timid, sensitive, highly sensitive child. So there isn't anything that you need any sort of learning support for, but maybe the environment is causing that child not to perform at his or her best. So I think you're hearing a lot with this one question.
Yeah.
Why are you
Oh,
laughing, Brad?
that was unbelievable. I was like,
I mean,
I don't even have a follow up.
I think it's just like I get the question in my head and I just picture this scenario. And so because I've just seen so many cases, and so many families come to us with having seen doctor to doctor, a therapist to therapist, and it's like, okay, well, what was missing was, and what's missing. So when I hear this question, I feel what's missing. Now, if this family just didn't include in this question that we are using strategies, we are knowing how to question, when to question, what to pull out, when to ask choice questions, using the visuals in a proper way. And in our case, we use the bridge that gives a very secure, control-based visual guide, for the children to understand where they are on the bridge. It's like a roadmap, right? And so it helps them feel in control, the bridge, so they know where they are and what they're working towards. So it's a very cognitive approach that we use in treatment, and we base it on their feelings, and we teach them how to rate and grade their feelings, and we teach parents how to question them about that. And we are very supportive and understanding, which so many therapists are, don't get me wrong. But for us and for me and for those that I train, I think the bridge is just critical. And what I've seen is that when children understand the bridge, when they understand how to rate and grade their feelings, and they know what the games or goals are they're working on, and it's done in a way that trusts their feelings with us guiding them, right? We're facilitating. The kids do fabulous, whatever
Mhm.
strategy recipe you're putting together. And so maybe they're doing all that. Then yes, maybe medication is the next step. And as long as you understand as parents how to bridge, when the child bridges down, you understand why that child is bridging down, and you understand what strategies to use to either accept them in that environment or to bridge them up, and how to bridge them up. um I that's going to be critical here, Bran. It's just critical. I'm just a
Okay.
big advocate of setting up the world, but also doing the interventions before I would jump into medication.